Sir, my question for presentation today is snake envenomation management, sir.
Okay.
Introduction. There are 3,000 species of snake identified worldwide, but only 1/10 of them are dangerous to human beings. There are three major families of the venomous snakes. Mainly, they are classified, belong to the three major families. Uh, the Elapidae, which consists of the land snakes, mainly the cobra, krait, and coral snakes. The snakes of this family have short, fixed fangs, which contain venom channels. Their tricolor bands, black, red, and yellow, white, encircle the body, and they lack the laurel shades. Uh, and next is the Viperidae, mainly consists of wrestle viper and bamboo snakes. These are further classified into pit vipers, which are crotalinae, and viper and vipers, which are viperinae. Their fangs are long and movable. The pupils are vertically elliptical. The ventral plates caudal to the anus are in single row. These snakes have a heat sensing pit and a small depression on the side of the head for location of the prey. And next is the Hydrophilidae. Mainly they are sea snakes. They are mainly found in the land regions near the sea, and they have a small head and a flattened tail, which help them to the swim. Next is the factors which contributing to the severity of the envenomation and the prognosis. The factors contributing uh, The factors contributing to severity and outcome in the snake bite are mainly the size of the victim. The bigger the size, the good is the outcome. Due to less amount of the toxin per kg of body weight, children receive larger envenomation related to their body size. Comorbidity is already present, which predisposes to the harmful effect of the snake venom. The elderly victims succumb more easily to the snake venom. The old age, anemia, hypertension, diabetes, and renal disease. The part which is bitten, the patients bitten on the trunk, face, and directly into the bloodstream have a worse prognosis. Exertion following the snake bite has poor outcome due to enhanced systemic absorption of the toxin. Individual sensitivity. The sensitivity of the individual to the venom modifies the clinical picture. The bite characteristics, the bite number, depth of the bite, whether it is dry bite or a bite through the clothes, shoes, or other protection, amount of the venom injected, condition of the fangs, and duration of which snakes clings to the victim all affect the outcome. Snake species. Different species have different lethal dose, lethal period, and aggressiveness. Secondary infection. Presence or absence of pathogenic organisms in the mouth of the snake also affects the outcome. The treatment, the nature of the first aid given, and the time elapsed before first dose of the antivenom mainly affects the outcome of the patient. Next, going to the pathophysiology, sir. Snake venom is a very complex chemical poison containing multiple proteins and peptides. The main components are the proteinases, hyaluronidase, cholinesterase, phospholipase A, phosphomestrase, phosphodiesterase, and the other enzymes like neurotoxins. And the release of the bradykinin, histamine, and adenosine, which are the endogenous mediators, also further complicate the um, envenomation. The, the classes of the snakes are viper are mainly vasculotoxic, elapid venom are mainly uh, neurotoxic, and they cause wet gangrene, and the sea snake venom are mainly myotoxic and neurotoxic. The clinical features. The clinical features, the signs and symptoms of the snake bite are mainly four main categories according to the envenomation, and it mainly the suspected snake bite can be divided into a overt bite or an occult bite. The overt bite is usually non-venomous, which is 70%, and venomous, which is 30%, and overbite may be asymptomatic, and patient may present with anxiety, palpitation, tachycardia, paresthesia because of the anxiety. And the symptomatic lesions mainly there is progressive pain, swelling, neuroparalysis, vasculotoxic, and myotoxic. The the dry bite, the bites by non-venomous snakes are common, and bites by venomous snakes special are not always accompanied by the injection of the venom, and the pain is less, but the patient may have anxiety. And in neuroparalytic, the patient will have progressive weakness. It is mainly seen in the elaborate envenomation. Neuroparalytic snake bites present typically within 30 minutes to 6 hours in case of the cobra bite, and 6 to 24 hours in case of crate bite. And doses in crate bite have been recorded less than 36 hours after hospitalization. The symptoms can be easily remembered by 5Ds and 2Ps. The 5Ds mainly dyspnea, dysphonia, dysarthria, diplopia, dysphagia, and 2Ps ptosis and paralysis. Mainly the cranial nerves are affected. The main cranial nerves are third, fourth, sixth are usually affected. The additional features like stridor, ataxia may also be seen. Uh, the bilateral, dilated, or poorly or non-reacting pupil is not the sign of the brain dead in elaborate venom. Coming to the vasculotoxic, hemotoxic or bleeding may be the main sign, and this occurs in the viperine family envenomation, and the local manifestations are mainly local swelling, bleeding from the bite site, blistering, and necrosis. Pain at the bite site and severe swelling leading to compartment syndrome may occur. And there is tender enlargement of the local draining lymph node, because the venom is mainly spread into systemic uh, circulation through the lymphatic drainage only. The systemic manifestations may be visible systemic bleeding, like ecchymosis, epistaxis, uh, vomiting, hematemesis, hemolysis, or hematuria, and bleeding or ecchymosis at the injection site or at the bite site. The skin and the mucous membrane may show evidence of petechiae, purpura ecchymosis, plebs and gangrene, and the swelling and the local pain. Acute abdominal tenderness and gastrointestinal bleeding may present, and there is consumption coagulopathy may be present in viperine family. The viperine family may also present in like diarrhea, vomiting, nausea, vomiting, fever, chills, dizziness, and syncope may also be present in the viperine bites. And coming to the myotoxic are the mainly sea snakes, and this have muscle aches, muscle swelling, involuntary contraction of the muscles, passage of the dark brown urine, compartment syndrome, cardiac arrhythmias due to hyperkalemia, acute kidney injury due to myoglobinuria, and subtle neuroparalytic signs may be present. And these signs are not strictly to the there will be overlap of the signs may be present. Sir, continuing, sir.
You finished?
No, sir. Management is there, sir.
Okay.
Sir, management of the snake bite. The management can be first aid, pre-hospital care, and specific therapies and the supportive therapies. First aid.
Go ahead.
Sir, I haven't finished, sir.
Yeah, go ahead. I am
Sir,
saying go ahead only. I'm not saying stop.
first aid measures. First aid at the level of the community or a village level. Uh, there's the history of snake bite should be checked, and we have to look for the obvious evidence of the bite, the fang marks, puncture marks, bleeding, swelling, or of the bitten part. Patient should be reassured that 70% of the snake bites are non-venomous. And next is to immobilize the limb like a fractured limb. Uh, the limb is immobilized, and a tourniquet may be applied, but the usefulness of the tourniquet is not um, it's not recommended, sir. The tourniquet is mainly to block the lymphatic drainage, so the to retard the spread of the venom. The tourniquet applied should not compress the uh, venous drainage or the arterial circulation or the interstitial circulation. The appropriate tourniquet should be that type that one finger can be passed below the tourniquet. And next is the nil by mouth till the victim reaches the medical facility. And traditional remedies are not proven effective, like the stones, black stones, and the victim should be shifted immediately to the hospital with the help of an ambulance, or if the ambulance is not available, patient can be shifted in whatever mode of vehicle is available, and the patient should be kept in a the victim must not run himself or drive himself to the health facility. The exertion should be avoided, and if in and the shoes, the rings, the watches, the jewelry, any tight clothing should be removed from the bitten area just to avoid the compression from or compartment syndrome, and the blisters to be undisturbed, and no time should be wasted in attempting to kill or capture the snake because it may be dangerous, and the patient should be shifted in the left lateral position to avoid vomiting and aspiration. And next is the cutting and suctioning. The cutting and suctioning of the wound is not actually recommended, but if proper suctioning, it should be under a medical trained person with the help of an extractor device named Sawyer first aid kit. And electrical therapy or cryotherapy, the evidence of these benefits are not that much recommended, sir. Next is at the hospital, patient received in the hospital. Patient received at the and the patient should be shifted after calling for a help or to just to confirm whether ASP available at the center where we are referring the patient. And patient received at the tertiary care center, patient to be examined first, like a normal ABCD approach. Check for the airway, breathing, circulation, disability, and check for the bite marks, and a proper history to be taken regarding the time of the bite, and what are the first aid has been done, and whether the patient had any comorbidities or not. A detailed history to be taken, and the clinical examination to be done. Clinical examination regarding the BP or pulse rate and the saturation, and the patient is having any dangerous signs like ptosis, muscular weakness, distress, or respiratory arrest, or the patient is had passed any dark colored urine or any other hemorrhagic signs should be examined, and should be examined for the local lymph nodes and for the spread of the venom. The according to the clinical signs and symptoms, the patient can be classified according to the severity of the envenomation, like no envenomation, absence of local or systemic reactions, only fang marks are present. Mild envenomation, fang marks, moderate pain, minimal local edema, that is less than 15 centimeter, erythema present, ecchymosis, it may be present or absent, but no systemic reactions. Moderate envenomation, fang marks are present, severe pain, moderate local edema, 15 to 30 centimeter is present, erythema and ecchymosis are present, systemic weaknesses, sweating, syncope, nausea, vomiting, anemia, thrombocytopenia is present, and in severe envenomation, fang mass is present, severe pain, severe local edema more than 30 centimeters, erythema, ecchymosis present, hypotension, paresthesia, coma, pulmonary edema, and respiratory failure may be present. According to the severity, and the patient is managed, patient should be evaluated after the thorough clinical examination. There are some laboratory investigations to be taken. The simple test is the 20-minute whole blood clotting test, in which a few ml of fresh blood, venous blood, is taken in a new clean dry glass and left it at the ambient room temperature for 20 minutes. The glass vessel should be left undisturbed for 20 minutes, and then it is gently tilted and see whether the blood is clotted or not. Uh, if the blood is solid, that is, has clotted, the patient has passed the coagulation test and no ASP is required at this stage. The patient is retested every hour for the first 3 hours and then 6 hourly for 24 hours until the test is negative or there is clinical evidence of envenomation or a dose of ASP is indicated. If the test is taken and ASV is given, the test is repeated 6 hours after administration of the loading dose of ASV. And in case of neurotoxic envenomation, the test is repeated after 6 hours. And in the tertiary care hospital, if we have facilities for prothrombin time, platelet count, activated prothrombin time, clot retraction time, liver function test, renal function test, serum amylase, ECG, and abdominal ultrasound, and 2D echo if available, it should be taken. And the specific management is the anti-snake venom. The anti-snake venom mainly available in the India, mainly available are monovalent or polyvalent. In India, we have polyvalent anti-snake venom. It mainly consists of, it is effective against 4 common species like Russell viper, common cobra, common kite, and saw-scaled viper. The ASV forms available are either lyophilized powder form or in a liquid form. In the lyophilized powder form, the cell life is longer, which is 5 years, and it requires no cold chain. In the liquid form, the speed of reconstitution is immediate, so that the time is saved. And the disadvantages are it has a short cell life, which is 2 years, and it requires a cold chain. And dose of the ASV. Dose of the ASV for the vasculotoxic for the neurolytic snake bite, the antisynaptic venom 10 vials stat as infusion over 30 minutes is given, followed by second dose of 10 vials after 1 hour if no improvement is seen within 1 hour. In the case of vasculotoxic snake bite, there are 2 regimens followed, which is low dose infusion therapy and high dose infusion therapy. In low dose infusion therapy, 10 vials for Russell viper or 6 vials for saw-scaled viper is given stat over 30 minutes, followed by 2 vials every 6 hours as infusion. And in high dose intermittent therapy, we have 10 vials of polyvalent ASV start over 30 minutes and followed by 6 vials 6 hourly as a bolus. And there are no ASV available for sea snake bite or pit viper bite. In case of pregnancy, lactation should be continued and the ASV dosage remains the same for the pregnant patient. And for pediatric patient, since the amount of venom injected is same in the adult, pediatric or pregnancy, the ASV dose remains the same. Only the dilution is it is reconstituted in the normal saline. So lesser amount of normal saline, that is 5 to 10 ml per kg of normal saline is used in the case of pediatrics to avoid the fluid overload. And in case of anaphylaxis regarding anti-snake venom, the anaphylaxis reactions are mainly pyogenic reactions or late serum sickness type reactions. The mechanism of anaphylaxis reactions are mainly by the complement reactivation. The management is the epinephrine stands the drug of choice. Epinephrine given is 0.5 milligram in case of adults intramuscularly or over the thigh. In case of mild reaction and in case of severe reaction, 0.5 milligram of 1:10,000 adrenaline can be given IV. And chlorpheniramine maleate Adult dose of 10 milligram and children dose of 0.2 milligram per kg is given intravenously. And the anaphylaxis is not a contraindication for ASV injection. And in case of high risk of anaphylactic people, the dose of ASV to be started is 1 in 10,000. 0.1 ml is given IV, and with that, other than
Carry on. Problem with the audio. Go ahead.
shall I continue, sir? Sir.
Yeah,
Airway support item. Sir, airway
Everything
support
is-
item is to be kept ready, and if the patient loses the airway reflexes, cough reflex, or patient is having respiratory distress, patient should be intubated immediately, and in case of difficult airway, laryngeal mask airway should be used. And for hemotoxic envenomation, patient should be assessed for hypotension and
the audio is going off on and off.
screen for persistent severe
Continue, ma'am.
state, but the clotting factors. Sir, continuing, sir.
Yeah, your audio is breaking on and off. Please check it up and continue.
Sir, am I clear now, sir?
Yes.
For a hemotoxic snake bites, for hemotoxic snake bite, patient to be watchful for the danger sites like hematuria or massive hemoptysis, and patient to be kept in strict bed rest to avoid minor trauma, and volume replace. All these things should be done. The sarin or antifibrinolytic agents. And in the case of neurotoxic snake bite, neostigmin can be given, sir. And patients having renal failure, the indications for dialysis are absolute value of blood urea more than 130 milligram per deciliter, and blood urea nitrogen 100 milligram per deciliter, or serum creatinine more than 4 milligram per deciliter, or fluid overload leading to pulmonary edema, or hyperkalemia more than 7 millimoles per liter, or a hyperkalemic ECG changes are present, or unresponsive patient to conservative management, or other uremic complications like encephalopathy, pericarditis, or nausea, vomiting are present. In the prophylactic, post-alkaline diuresis can be done with injection furosemide 40 milligram or mannitol solution 150 ml over 20 minutes can be used. Other than that, there is pain and wound management. The pain management, the drug of choice is paracetamol, or a less sedative opioid, tramadol 50 milligram can be used. Then antibiotics and tetanus therapy. All patients of snake bite should be administered tetanus injections, and antibiotics should be started. Antibiotics can be injection amoxicillin or plus clavulanic acid, and injection metronidazole 400 milligram IV infusion for 7 days can be given. And in cases of life-threatening conditions, patient may require surgery like debridement of the necrotic tissue, or patients having intracranial hemorrhage can decompression surgeries may be needed, and compartment syndrome, emergency fasciotomy to be done. The compartment syndrome signs are 6 P's: pain on passive stretching, pain out of proportion, pulselessness, pallor, paresthesia, and paralysis. Immediate fasciotomy to be done. And other than that, patient should be followed up to 5 to 10 days for the late reaction for late envenomation signs, and following ASV, serum sickness signs like fever, joint pain, and joint swelling. And patient should be uh, helped with rehabilitation like scar contractures, equinus deformities, and rehabilitation procedures to be done. Finish, sir. Thank you, sir.
Okay. What is the source of your answer? Where did you prepare it from? That Union Government Guideline book, 180 pages,
Yes, sir. Standard treatment guidelines, sir.
standard treatment guideline. Okay. You think you will be able to write all these points within the 20 minutes available for you in the theory exam?
No, sir.
So you must prepare it in such a way that it will be helpful for you to reproduce it in the examination. Okay. First
Okay,
thing
sir.
is you don't have to spend so much time on elaborating how to differentiate one variety of snake from the other, right? Describing their scale, their color, this and all that, not necessary. You just mention the most poisonous snake which can produce envenomation are cobra, viper, krait, and saw-scaled. These are the four important varieties of snake. Rest of them mostly are all non-poisonous snakes in our country. And there have been, of course, while presenting, you have been repeating again and again about the anxiety, tremor twice, and then the clinical picture and all that. So I have also prepared my presentation from the same source, but I would like to just share that with you. So how you can just modify the same thing from a little bit from the